Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about, are pacifiers good or bad for your child's oral health? Let's start. So this is a very important episode for all the nursing mothers out there who have been using pacifiers for their infants. Now, the controversy has been, kind of puzzling us for the longest time. So I decided to make a video on the question if pacifiers are good or bad for your child's oral health. Now, pacifiers were actually started way early in around the 16th century. So, and as the word says, it's known as pacifier. The word pacify means to calm down. When it comes to your children obviously, especially your infants who are non-verbal because of the fact that they have not reached that milestone, and brain development, because of which they tend to just express all their emotions, be it hunger, be it any sort of abdominal distress or anything of that sort, through the help of crying. Now, pacifiers were so-called made for that purpose, so that they could have a calming effect on the child's health. Now, initially they also coated the pacifiers with opiates and alcohol, which I would highly not recommend to mothers doing that. And also they have used formula and sugary substances, so that when the child is kind of cranky, it kind of soothes the baby. Now, what are the possible benefits of pacifiers? Now, a lot of times it's been shown that definitely it has a calming effect on children, and especially if because unfortunately most of the infants are very susceptible to infections and may require some sort of medical assistance and tests such as catheterization and all those things, because of which the child can undergo, like injections and vaccinations, the child might undergo distress, and that's why to soothe the baby we use pacifiers. Also, it has been found that over a long period of time in the long-term studies, that if you give your child a pacifier at the right time for the right duration and wean it off at the right time, there's a high likely chance that your child will not have a digit sucking habit. That means finger sucking habit or thumb sucking habit. So let's talk about the potential risks of pacifiers. It's very simple. Obviously, pacifiers, if used for a longer time, can lead to a lot of problems such as poor oral hygiene, increased risk of caries, and increased risk of transmission of infections from the environment to the child, because of the fact that the pacifier might be dropped, it might not be cleaned or sterilized properly. Now, it has been found out that the biggest downside of using pacifiers to a lot of extent is that the baby is kind of weaned off breastfeeding habit early and earlier than usual. So basically what happens because of that is, because the mother's milk consists of very great nutrients, a lot of good nutrients, and those nutrients are no more given to the child because of the weaning off of the breastfeeding early on because of the use of pacifiers. That's why it is considered that because of these pacifiers, the bottle feed is given more to the child, and there's more of use of milk formula rather than the mother's milk. And that's where the problem starts when it comes to nursing bottle caries, poor oral hygiene, maybe a little delay in the milestones over a long period of time because of the fact that the child has been weaned off early from mother's milk. Now, when it comes to malocclusion or the propensity towards malocclusion, you have to understand that the action of sucking with the help of a pacifier is actually not natural as compared to suckling. Now, suckling is a different form of action which uses the cheeks and the lips and everything, and it's just the piston-like motion of the tongue when it comes to the pacifier, and that's where you might have problems because of a negative pressure that is created in the child, and that might lead to the constriction of the maxillary arch width or the upper jaw bone width, and also it will lead to increase in the propensity towards decreased vertical dimension of the maxillary jaw. On top of that, it creates a negative pressure in the canine area. So in this cornermost area, over a prolonged period of time, if the pacifier is used, there's a high likely chance that you might have skeletal malocclusion or dental malocclusion that may be present. Also, obviously, because of the prolonged use of the pacifier in the mouth, there is more propensity towards lack of oral hygiene, more propensity towards dental caries, and as well as in the long term use, maybe it might cause some temporomandibular dysfunction. Now, what is the solution to it? The simple solution is, you have to make sure as a parent that you're not using the pacifier for some time after the birth, especially 28 days after birth. For the first 6 months, you have to make sure that the baby is breastfed, and after that you can probably switch them over to a pacifier to not more than 6 hours per day. That's the most important thing. Every time after every feed or every soothe of the pacifier, you're supposed to either steam sterilize it or cold sterilize it using a Milton solution. Please make sure if your child is in a daycare, you have to make sure that there should not be any sharing of pacifiers, because that leads to translocation of bacteria and other pathogens that can cause oral health diseases. Make sure that you are maintaining whatever, with the help of a hand health cloth, the gum pads of the child are clean, and make sure that the pacifier is weaned off once the child's early permanent teeth have erupted. So it's very important that you need to make sure that you need to wean off the child of a pacifier, either by gradual withdrawal, or sometimes you might have to do it immediately. But for all these things, you need to speak to your pediatrician and your pediatric dentist regarding these things. Also, one thing you have to understand, that otitis media, that is middle ear infections, are very much related. Although there has not been a causal effect that has been demonstrated, but it is known that there is a correlation that prolonged use of pacifiers may lead to recurrent otitis media or middle ear infections in the children because of the connection of the eustachian tube. And finally, you have to understand that you have to speak with your pediatric dentist or pediatrician regarding when, how, and by what means you can wean off the child from the pacifier as soon as possible as the child reaches that particular age. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients or otherwise, and just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's giving you discomfort, and we can have a dialogue after that. If you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.